Welcome to Nurse Practitioners Changing Practice. We are very fortunate to have Dr. Dixon to agree to come on and talk a little bit more with us about motivational interviewing, especially techniques. Dr. Dixon is a licensed professional counselor and she is certified in drug and alcohol rehabilitation. So Dr. Dixon, welcome. Thank you for coming on again.
Absolutely. Thanks for having me back.
So last time we talked a little bit about what motivational interviewing is, and it's a new hot subject, I think, for providers. We're trying to wrap our heads around it, trying to see how we can embrace this. We talked about the sacred space that is created when a patient starts talking about things to a provider that they wouldn't reveal their weaknesses. And, you know, it needs to be that judgment-free zone, that area where we can trust, you know, each other and build a relationship and be supportive of our patients. So some of the things I was thinking about is how do we apply motivational interviewing? What are some techniques we can use that apply to a broader range of, you know, we know about addictions, we know about smoking, we know about alcohol, but like, you know, like heart disease is still the #1 killer in the United States, right? And diabetes is huge. Hypertension is hard. When we look at all of these things that we need to build a healthier lifestyle, how do we help our patients? How do we partner with them for making positive life changes? Yeah, and not just giving them a prescription.
Yeah, so I love that you brought that up because I do feel like sometimes because motivational interviewing is so associated with addiction that other specialties don't see it as something that applies to them. But motivational interviewing really is something that helps you to meet a client where they are, assess where they are with readiness to change, and then help them to be able to keep progressing forward. You know, like meeting someone where they are, but still having that goal in mind of like a healthy person, health and wellness, you know, but they might still be making some unhealthy habits, and meeting them there and seeing what small changes that you could make to change something. Like I'm kind of example for me would be somebody who's struggling with something like weight loss, you know, somebody who's coming in and they're having all these different health conditions because they're overweight, and you as a provider are trying to help them make changes.
How do we approach that? That's always an uncomfortable topic, you know, because we have to take their BMI and we have to chart in the chart which stage their BMI is. So you're writing that word obesity, you know, which mine crosses over into a couple of times, you know, and it's just a bad word. But how do I talk to my patient about you know, weight loss and not be offensive? And what if they're not at a point where they, you know, they're ready to change, or they feel like they've tried everything? How do I be sensitive and yet, you know, helpful at the same time?
Yeah, I do think it's okay to be direct. It's okay to state things like, you know, one of the things that's contributing to, you know, whatever this health condition is that you're having is, you know, your BMI, your weight level. You know, I think it's okay to use direct words and not to feel like you have to beat around the bush. But there's a huge difference between being direct and honest and being, you know, like confrontational or judgmental. There's a lot of wiggle room there in the middle. And so, you know, just being honest and saying, you know, it would really help if we could, you know, make weight loss a goal for you. That would be something that could help with your cholesterol, or, you know, whatever it is that you're looking at. And then, you know, talking to them about their feelings about that, you know, say, what are your feelings about that as I share that with you? You know, is this something that you've tried in the past? Have you tried to lose weight in the past? And many people have, you know, and so that'll be your chance to listen to them and listen to the things that they've tried. And I know you guys have a short amount of time with people too. Motivational interviewing is something that's going to be helpful for those practitioners that have ongoing relationships with their patients, you know, kind of like when you were that family nurse practitioner, you know, in Ellsbury, and everybody came to you and got to know you. You might have a short window with them, but you're going to
had repeated. Yeah, there was repeated time. So we could set a short goal and say, okay, you know, we're going to have this goal and I'm going to check with you in a couple of weeks and see how we're going. Or maybe I was teaching them how to use an app to help them track their steps or track their their diet or something like that. And then so we did have opportunities to have, but I always did find that uncomfortable sometimes approaching certain subjects, especially when they really weren't ready to change it.
Yeah.
What do you do with that? How do
Yeah.
you handle that?
So when you find someone who's not ready to change, realize that there are limits with what you can do. People are in charge of their behaviors. You know, you can make recommendations and things, you know, for a patient, but they're still ultimately in charge of their behavior. And so the best step for you then is to express empathy, you know, let them know how important that these changes are and encourage them to even make small, slight shifts, you know, towards a healthier goal. Because if you're, you know, really strong and just, you know, you need to do this and, you know, this is the problem, and, you know, just kind of saying things that way, not that they don't need to know how serious it is, you know, but when you're able to kind of acknowledge it, listen to their frustration and show a little bit of empathy. This is where that empathy piece is so important. Just so I know this is hard. I know this is hard to hear. I know these are hard decisions to make. You know, but what is one small shift that you could make just to help us be able to bring down, you know, this level? Or, you know, if you can't take on changing both eating and exercise at the same time, let's focus on one of those areas and see what we can cut out. You know, maybe we can start with deciding that we're going to cut out, you know, all candy bars. Like, we're not going to get that candy bar at the gas station. You know, let's make that a small step there, you know, just to kind of help them see that you don't have to throw the baby out with the bathwater. You can do, you know, one small step towards your goal, you know, and then keep adding from there.
So one of the things I try to stress too to my nursing students is that, like you said, it is the patient's life and they have a right to make their decisions. And we really could know that it might be better if they stopped this or stopped that, or did what we thought was best, but it ultimately is their decision. And we have to respect that too, and not necessarily judge them for making bad decisions, because all of us have habits that, you know, we could be giving up, right? You know, so if a person has smoked for a long period of time and they have COPD, well, it's not just their fault. Why should we treat them? You know, and I think sometimes providers kind of get in that mindset like a parent. I told my teenager to do XYZ and they didn't do XYZ, but if I tell them enough times to do XYZ, that'll make it better. And that never makes it better.
Yeah.
That doesn't, it doesn't seem to work.
Yeah. And I do want to make sure though, because I know from, you know, a medical standpoint, I know you guys are so used to, you know, your prescribers. That's a huge part of your role.
That is our role. Yeah.
You need to make something better. But at the same time, realizing that people are not always going to follow you through with those prescriptions. And so it's okay to let them know the seriousness. It's okay to let them know, hey, you know, if you do continue down this path, these are some of the things that I see becoming issues for you. You know, this shortness of breath or this, you know, whatever
it is. Yeah.
Going to continue to increase. You know, so this is why I'm trying to partner with you. Let them know the why, you know, let them know that you care, you know, that you want them to have a better quality of life, and really taking the time to be able to listen and keep building each time that they come. And then anytime that you see the slightest bit of improvement, let them know how impactful that is. That's huge. You know, you stopped getting the candy bar from Quick Trip, you know, on the way home from work every day, or, you know, you cut back your portion size, you know, started eating from a smaller plate, you know, rather than a dinner size plate. That's huge. You know, I love this. What else can we do next? You know, show that excitement and really, you know, reminding them and yourself, you know, because we want to we go into these helping professions, whether it's mental health or physical health, because you want to see people just succeed. And so it's hard to step back and realize, you know, that we cannot make these steps happen for people. We get to be with them in the journey. We get to provide our expertise and help them. But this is ultimately something where the self-efficacy lays on them. Another thing too, like you were saying, you meet resistant clients. A big piece of motivational interviewing is rolling with resistance. So when you encounter those resistant patients, you know, which I'm sure you do, I do, roll with it, listen to them. You know, when they start to, you know, go on about their experiences and go on about the problem and they do the yes buts, it's okay. Be like, I understand. It sounds like you're telling me, you know, that this has been a long struggle for you and that you've taken a lot of efforts and it sounds like you're very frustrated. Let's just come up with one small shift. What's one small, you know, even if it's just a mindset change, you know, for now, And then we get to those behavioral changes later. It is at least a place to start.
I think I love what you said is being with them in the journey. And I think in providers, we think we need to be the answer and the solution to the problem. And I think that's one small shift that we need to make, is that we are with them in their journey,
Yeah.
trying to help them become the best version of themselves.
Yeah. I mean, I encounter, from the mental health side, a lot of my,
I
clients.
don't hear you, Lynette. I think
Oh,
we're,
shoot.
yeah, there you are. There you are. Okay,
Can
good.
you hear me now? Okay. Sorry about that.
Yeah, I don't know. Sometimes it freezes up. It's probably my internet. I'm getting my internet's unstable, so hang in there.
Okay. So you can hear me now?
Yes.
Okay. So I was just saying, I encounter patients who feel like, am I always going to feel this way? Is there any hope for me? Things just aren't changing, and they feel this sense of frustration. And, with me, of course, I'm working a lot on just accepting those feelings. It's okay to feel this way. Accept the feelings, send yourself self-compassion and love in those moments. But whenever you're meeting someone who's feeling that frustration, a lot of times I will tell them, I can't change this situation, for you, but I will be with you on this path as long as you want me to be. I will be there with you, and I will help you, because I always remind my clients that they're the ones doing the work. And the same is really true with, I know you guys
It is true with us too. I mean, no matter what, we might prescribe their blood pressure medicine, we might control their diabetes, we might help them with their weight loss, we might be helping them with their thyroid. But in every situation, I've found that people need to, first of all, know you care.
Yeah,
You care
absolutely.
about them, and you want to listen to them. And that's hard for me because I'm a talker and I always want to fill that space.
Yeah.
But you have to listen to your patients and build that trust and tell them, because it shouldn't be a fake caring. You should really care about them.
Yeah.
I came to love my patients as my family.
Yeah.
And treat them as if they were my own mother or father or sister or brother. And I wanted to know what their goals were, and I wanted to celebrate with them and cry with them. And I wanted them to know that I really was there.
Yeah. And I know that's a natural gift that you have. It is a natural gift that I have as well, but this can be learned for those people who do struggle in these moments. Both of my daughters really struggle. They're the kind that are like, when you're sad and you're upset, they, kind of like, they're like, don't do this to me. I don't know what to say. Sometimes
Yeah.
providers, might have that personality too, but these are skills that you can learn by asking the right questions, by realizing, and reminding the patient that really they're in charge of their health. You're going to be the one prescribing. You're going to be the one who might be telling them about treatments that they need, or might be, going over lab results or ordering tests, but they're the ones that are going to be living with this every day. They're going to be in charge of taking their medications. So that's the same type of thing that I do from a mental health side. You're the one who's going to have to, come to these realizations. You're the one who's going to have to maybe follow through with these breathing techniques or these different exercises that I prescribe from a mental health side, but reminding them that they're in charge of this journey, because the same is really true on both sides. That is one of the other foundational pieces of motivational interviewing, is that rather than confronting, you're collaborating. You're letting them know, I'm collaborating with you to improve your overall health and wellness. This is a discussion. This is, a safe space where you're coming in and you're part of this. It's, doctors and medical professionals are experts. I'm an expert in mental health, but really when you're encountering that person, you have to acknowledge they're the expert of their life.
Absolutely.
We bring our expertise, but they are always the expert of their lives. They know their history and they're the experts there.
They know what works and doesn't work for them.
Yes. So some of the, I know you want practical strategies, and let me know with time. So I know you try to keep it within time. So kind of let me know if I'm going too long. But one of the other pieces of motivational interviewing is that you are trying to draw out more from your patients. You're trying to get them to expand by asking those open-ended questions. Whenever they give you some bit of information that's helpful, like when they say, well, yeah, whenever I, do this, whatever it happens to be, I notice that I feel better, oh, great. Tell me about that. Tell me a little bit more about that. When are you able to feel like you're able to stick with your diet? Or when do you feel like you're able to really get a good night's sleep? What things are going on for you, in those times? When do you feel like you're able to kind of manage those cravings from smoking or, from whatever it is? and get them to share more, which I know is hard because you guys have like 15 minutes. I do
And
get it.
we also are used to being the ones that direct the conversation rather than draw out information from our patients. And that is, I mean, now there are times we do. Like if I'm trying to find out whether your chest pain is a heart attack or it's indigestion, I have specific questions I'll ask to draw out the information I need. So we need, as providers, need to learn how to do this with other things as well, because I think that we have like the specialized set, but we only use it with symptoms.
Mhm.
And we need to broaden it more for, saying, tell me more about what's going on in your life. Tell me what you're feeling when you're, not being able to sleep at night. What's going on in your head? We need to learn how to phrase those questions in that way.
Yes, absolutely. Another thing, that can kind of help you to be able to notice where a client is and maybe help them shift from just sort of thinking about, oh, do I want to, take on this change that my provider is encouraging for me or not, is to notice discrepancies and develop those discrepancies. So anytime that you notice them pointing out a time where their behavior doesn't quite match with what they're wanting for themselves, that is a time that you can build on. Like, I know you're wanting to have energy. You're telling me you're wanting to have energy to interact with your kids more, or you're wanting to have, this energy to be able to, not fall asleep when you come home and you're sitting down and watching TV. But then you're telling me, that exercise is something that's hard for you to fit in. Tell me a little bit more about that. Exercise can be something that is helpful and can give people, that extra boost of hormones and endorphins that are going for you. What is something, even if you don't want to take on a huge exercise routine, what are some activities that you've engaged in the past that help you to feel that sense of energy and balance? Because that's like a discrepancy when someone's coming to you and telling you, boy, I'm tired of being tired all the time. But then they go over, ask them, what does your day look like? Those are great questions. What does a typical day look like for you?
Yeah. What are you doing? Yeah. What are you eating? What's a typical day that
meal?
like I'll say, I want to lose weight. I really do, but I like my Pepsi every day. And that's like two things that don't work together. So, I like that you need to point out, and then asking them, what does your day look like? What is a typical meal for you? Do you skip breakfast? Do you walk? Are you sitting all the time? Those are good things to ask.
Yeah. And just kind of pointing out, like I said, that these are some things that, maybe these two things don't quite add up. Do you notice that too, in their thought process with you when they're going over some of their activities? Those don't have to be times like where you're pointing your finger like, well, those things don't line up, but just say, I'm kind of noticing that you're saying this and you're wanting this. Tell me a little bit more about that,
or what could we do? Like for me, you might say, well, maybe before you drink your Pepsi, you have to drink one full glass of water.
Yes.
That could be a small change, because that by the time I'm drinking the water, I might not want that Pepsi anymore. Or some, like I said, there's a ton of things that we're asking people to change. I look at diabetics. That's the biggest one that I feel like they have to make such big changes in their life. They're checking their blood sugar. They're looking at their diet. They're counting their carbs. I don't even know how to count carbs, so I don't know how to tell. I mean, I know sort of, but I really don't pay attention to how much carbs is in all my food. So there's a lot of changes with diseases, people that have cancer, people that are fighting really hard things have a lot on their plate. And we just have to, I love what you said, be with them in their journey.
Yeah. And one thing that was kind of cool for me, which doctor I see, but I loved it, but it also kind of was, I'll tell you the story and then I'll go over it. But so I went in and we were talking about making a slight change to one of my medications, and I was like, I really kind of want to know from you here. I'm experiencing some dizziness, I'm on a slight high blood pressure medication. And I felt like, because I'd lost some weight and I really exercise a lot, that maybe the medication that I was on was too high for me now. And so I was trying to figure out, do we change the medication to remove, this one portion of it, or do we lower the dosage, but keep it, like that for a while? He suggested me cutting my pills in half. So I was kind of going over all that with him, and he was like, so help me remember the name of the medication. It's the hydrochlorothiazide chlorothiazide that's with it. Okay. I was asking, can
Yeah.
we take that part of it out maybe?
Yeah,
Is
because
that
you
what
were
I
on a
should do?
combination pill.
Or should I like just lower the, dosage, or what are your thoughts? And so he's like, he turned to me and he said, well, I really want your opinion on this too. And I was like, I love that you want my opinion, but I kind of need to know, like, and I want to be part of my health. He was reminding me that this is something that I need to weigh in on. And I loved that, because I do feel like we need to be able to weigh in on those things. So then I was able to just kind of turn to him and be like, well, I love that. I'd love to be part of this. Can you explain to me maybe what this piece does and what the difference would be if that meant that part is in there or if that part isn't, and what that would mean.
Well, and that just kind of made you feel like you were educated and could make a better decision as well.
Yeah, like I said, it threw me for a little bit of a loop just because I'm not super familiar with the medications, but I loved that he did it because I was like, well, you know what? This really is something that I need to be able to take ownership of, and then I was able to say, can you just explain to me, what this piece of the medication does? And then we can kind of decide from there if I keep either cutting the pills in half or taking that part out altogether or lowering a dose or, whatever we think. And so, I've never had a doctor in that instance ever
I
ask
think
me.
that we are. Yeah, I think we're getting more. I think the message is getting out. That's why I think this motivational interviewing is so popular. And your tips and taking the time to explain things that really work is so beneficial to providers. We need this more, and I think that in my experience, I'm seeing a shift. I'm seeing people want to know more about what healthy living looks like. What does a healthy diet look like?
Mhm.
Yes, I might still go get my McDonald's French fries once in a while, but I want to know, how many fruits and vegetables should I be eating a day? What does the colors of the rainbow look like? What are the more holistic things I can do in my life? And I'm starting to see a shift more toward those foundational things that we can do to make ourselves better. But I'm also seeing providers becoming more interested in partnering and educating their patients.
Yeah, I'm seeing the same thing. Like I said, I'd never had that experience before, but I also know, from my side as a mental health provider, we're having, people that come to us that are much more informed about things than they ever have been before because we have Google and we have different things that are accessible to them. I know it's not always like sometimes you get information that maybe isn't the best from those type of things, but people do get a lot of good information about different, therapeutic techniques that are out there. And I'm sure you get a lot of people who do know.
Yeah, they know about the medications, they know about their disease processes and all of that. So yes, so again, I want to thank you so much for being
Can I just
a
add
part.
one last thing?
Oh,
Sorry.
absolutely.
There's just one last thing I wanted to wrap up with was one last technique was to use reflective questioning and statements with your patients. That's the last part I wanted to add for our piece today. Just reflect on what they're stating. That really does get people to feel heard and it gets people to expand on what they're saying. So whenever someone says something to you, you can state back, this is what I hear you're saying. It sounds like you're feeling, this, or you're having this problem. Tell me more about that. So just kind of wrapping things up with that reflective piece. And then that changes also the way that you're listening to people. When you're mindful of, okay, I need to reflect back to my patient, it makes you listen for understanding, which is what we all want to do, whatever kind of provider we are. We want to listen for understanding, not just listen and wait for the pause until we can then state what we need to state next. So that's just the last little tip with motivational interviewing for you guys to be able to apply.
So listening for understanding is a really important piece because, like I said, we do practice it, but we practice it for listening to understand symptoms. That is, I think, what providers do. I want to really hear what you're telling me about how bad your pain is, where your pain is, what it is associated with. And I'm very good at that. I'm very good at putting those pieces together. But sitting down and just listening to a person talk about maybe problems they're experiencing, I need to work on. I need to figure out those are just as valid. Those are maybe even more valid. Those might be the underlying cause of the physical problem.
Yeah.
And I've definitely found that almost every physical problem has some type of anxiety or some type of a life challenge that goes with it.
Yeah.
And so those are really good, very good tips to give us to be able to be better providers. How do you, if they go, they go into a big speech about what they're going into, and then if let's say they've had a really, really rough time, as they've had a event that probably could really go into a half hour, an hour session, and you are limited by time. How do you gently pull back and say, we need to do this, we need to set up more time to talk about this? How do you do that and not make them feel like you're just shutting them down?
Yeah, no, absolutely. Acknowledge, say, it sounds like you have a lot to share and I really want to hear. I'm so sorry to interrupt, but I do have a schedule to follow today. I'd love to follow up with you. Let's get you set up for another time next week, so that you do have more time, really just taking the time, and letting them know. I know for me, whenever I have to do this with people, sometimes I'll gently just kind of touch their arm or something just to like, kind of show that, hey, I'm needing your attention, and then really just making that eye contact and stating kindly, that I'm so sorry to interrupt you. It sounds like you have so much to share with me. And I want to be able to create a time where I really have that time to truly focus on what you're stating and problem solve with you. Let's go up here and talk with, Judy, that's the name of the receptionist you used to have, and schedule you for next week, so that shows here, I really do, want
I
to
do
be able
care.
to
And I
create this
want
time
to,
with
yeah.
and sometimes, before I start a line of questioning with people, I preface with stating, I'm going to be asking you some questions here, and I really want to be able to hear your answers. If I do have to interrupt you, I apologize. It's just for sake of me being able to get through this list, and we can come back at the end and you can share a little bit more on any parts that I had to interrupt you with, or we can reschedule for another time.
Or I know
tricky.
we have 30 minutes and I want you to focus on what's most important for you today.
Yes.
I also try not to look at the computer that much.
Mhm.
I try to answer the things I need in the computer minimally and then go back later and fill in all those details, because I really want my patients to know that I'm focusing on you.
Yeah. And that is so important. They've done studies about like screens, and even just having like a screen on and present, a cell phone out on the table, even if you're not looking at it, has really been shown to kind of make someone feel less heard. And so the more that we can tune in and really focus is always going to help, our patients to feel like we care about them. And I love your idea of letting them know at the beginning of the appointment, hey, we have this amount of time, and then kind of prefacing it with, if I do have to interrupt you, I'm so sorry, I would love to follow up with that another time.
But we have as many times as you need to come back, because
Yes.
I am with you.
Yeah.
And I'm going to be here with you through that entire journey of your health. And I think that's so important. Lynette, I just cannot thank you enough for sharing your words of wisdom with us today. And I can honestly say your patients are blessed to have you as a provider.
Thank you so much. One thing too that can be helpful is that this is a whole new framework for you guys to learn, a whole new line of questioning. And I know for myself, whenever I meet with people, I usually have a clipboard. You might have something similar, a clipboard, or sometimes people, wear a lanyard and have put things on their lanyard. But just kind of putting a few of these questions down on your clipboard or on a little laminated pouch on your lanyard can help you to sometimes remember what things to ask when you're stuck. And especially if you can put it on your clipboard, it's not super obvious, that you're referencing that, but just to kind of remember, hey, let me ask, or let me use some of these statements, like tell me more, and even if you're just adding in one of those additional pieces into your language, you can then keep building from there. Like, it's okay that it's a process, and it's okay if it's a little bit uncomfortable at first. Your genuineness and your heart being into it, they will feel that. So it's okay if you stumble a little bit, but I have done that, especially with some restorative type conversations. There's certain questions for that, in counseling that can be helpful. And so I have done that before myself, had some little.
Just have like a little cheat sheet so you can remind yourself, tell me more about that.
Because your heart is in it, but it is like you're adding a new vocabulary in, and it's okay.
And I like that, it is a journey and it is a learned technique. And I like the fact that we all can feel when somebody's being genuine.
Mm-hmm.
We can all tell when people really truly care and when they're just rushed and they need to come in and go out. And I would say that the providers who probably have patients who feel the most satisfied are the ones who do feel like the provider genuinely cares. And I've also found that patients can be very forgiving of
Oh,
the
yeah.
mistakes you make, which we all do, because they know you genuinely care.
Yeah. Yeah.
And if you miss
Absolutely.
something or whatever, if you didn't get it right the first time, if it took you a little while to finally come to the right things to help them, they're so understanding because they know you're trying your hardest to help them.
Yeah. And don't be afraid to say, oh, you know what? I didn't exactly phrase that correctly. I'm so sorry. Let me come back. Let's approach it this way. Because I'm sure there's tense moments that happen, when a patient comes in and they're upset about something. It's okay to kind of acknowledge that feeling, and say, I can tell that you're upset. I can tell that you're frustrated with me, and being able to kind of own those moments and just let them know. The main thing to let them know is like, we talked about before, I'm in this with you. You're not alone in this. I know you have to do the hard work in it, but I'm here with you.
I love that. Thank you so much, Dr. Dixon. And for those of you listening or watching this on YouTube, please visit us at our website, NPS Changing Practice. That's npschangingpractice.com. Listen to our YouTube channel or come to the podcast and join us for more. Thank you again.
All right, absolutely.